Traveling with Ozempic, semaglutide, or Mounjaro, tirzepatide, sounds simple until travel exposes weak planning. The biggest mistakes are not just airport scanners or forgetfulness. They are heat, freezing, dose confusion, missed meals, dehydration, and assuming vacation pauses side effects. The safest trip starts before departure. Storage, schedule, food, supplies, and backup decisions should be written down before problems begin. Most travel problems start before the airport. People remember the pen, then forget the conditions around the pen. A beach bag, car trunk, checked suitcase, or hotel freezer can matter more than the flight. The medication is only useful if it stays usable. Another mistake is treating vacation like a pause button. Meals change, sleep changes, walking changes, and alcohol may appear. Your body still responds to the medication. If nausea, constipation, or low intake begins far from home, mistakes can be harder to fix. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. These medications do not simply lower appetite, they also make food stay longer in the stomach. When food stays longer, some people eat less. During travel, the same effect can worsen symptoms when meals are large, late, greasy, or rushed. The SAFE plan is not one trick. It connects the medication plan to the trip plan. Storage, spacing, meals, and symptom decisions all matter. That connection matters more than any single item. Storage is where a common practical mistake happens. Before first use, Ozempic pens are refrigerated. Used pens can be kept at room temperature for up to 56 days. Mounjaro pens are refrigerated, but each single-dose pen can be kept at room temperature for up to 21 days. Those numbers do not mean heat is harmless. Room temperature does not mean a hot car, sunny backpack, or luggage sitting outside. Can a colder bag create a different problem? Yes, because freezing is not safe either. Use a barrier between the pen and any cold pack, because direct contact can freeze medication quietly. Hotel rooms create their own storage traps. A minibar can freeze medication near the cooling plate. A bathroom can become warm and humid. A windowsill can get direct sun. Choose a stable shaded spot, then check the pen before use if the room felt extreme. That same storage logic also affects flying. The safer default is carry-on luggage. Checked luggage can be delayed, lost, overheated, or exposed to cold cargo conditions. Keep the medication in its original packaging. Pack needles, alcohol swabs, a medication list, and a hard container that used needles cannot pierce. Airport screening is easier when supplies are organized. The Airport Security Agency, called TSA, allows medically necessary medications and supplies through screening. A doctor letter is not always required, but it can reduce confusion during international travel. After airport screening, international rules can affect whether your medication is accepted at the border. Those border checks matter because a medication allowed in the United States may still create questions elsewhere. Bring enough supply, plus extra for delays. Keep the prescription label. Avoid loose unlabeled pens, and never assume a foreign pharmacy can replace your exact product. After your medication is packed and documented, the next practical risk is the weekly injection schedule. Travel breaks routines, and weekly medicines are easy to lose track of. Ozempic missed doses have a 5-day window. Mounjaro missed doses have a 4-day window. If that window has passed, the usual instruction is to skip and resume. Do not use 2 doses close together to compensate. With Mounjaro, the official instruction says not to take 2 doses within 3 days. A rushed catch-up dose can increase side effects. For diabetes patients, it can also complicate blood sugar planning. After missed dose rules, time zones create another quiet dosing error. The exact hour usually matters less than safe spacing. Pick a simple plan before leaving, using your home routine or a local routine approved by your clinician. Do not compress doses just to match a calendar date. Does travel mean you should skip the shot? Not automatically. Some people do better staying on schedule. Others need a plan before long trips, especially after severe nausea, dehydration, a dose increase, meaning a higher dose, or an emergency visit. Make that decision with your clinician before the trip, not in a rushed airport moment. A missed dose plan should also include what to do after a long gap. A long gap can happen after illness, lost medication, or travel disruption. Do not restart blindly at a high dose after a long interruption. Your clinician may want a slower restart, especially after intense symptoms or several days of eating very little. Once dosing is planned, food becomes the hidden travel trigger. Airport meals are often larger, greasier, saltier, and faster than home meals. Alcohol, less water, and long sitting can worsen reflux or constipation. Eating large, rich meals as if you were not taking the medication can make side effects feel sudden. The same food problem gets worse if the trip begins right after a higher dose. Side effects often appear after that change. Ask your clinician whether timing should be adjusted. Even if dose timing is stable, the travel day itself can still hide dehydration. Cabin air is dry, bathrooms feel inconvenient, and people drink less to avoid walking. If the medication already reduces appetite, you may not notice thirst as clearly. Plan fluids deliberately, not only when thirsty. The practical plan is simple, but most people skip it. Pack small bland foods, powder packets that mix with water to replace salt and sugar, and a refillable water bottle. Keep protein portions modest and meals smaller on flight days. If constipation is already a problem, discuss a bowel plan before leaving. Diabetes adds another layer. For diabetes patients, the bigger issue is the full treatment plan, especially insulin or diabetes pills. Those medicines can raise the chance of low blood sugar when meals are delayed or missed. Carry glucose tablets, blood sugar meter or sensor supplies, and a plan for days when eating normally is impossible. That is why backup nutrition should stay where you can reach it, not in the overhead bin. For diabetes, travel planning should include food, fluids, supplies, and clear reasons to call a doctor or seek urgent care. If vomiting starts, or you cannot eat or drink enough, the main danger is not inconvenience. The risk is dehydration, missed medicines, and not knowing whether symptoms are mild or worsening. Motion sickness, food poisoning, and viral illness can also cause vomiting or very low food and fluid intake. When the cause is unclear, warning signs help decide when to get medical care. Do not ignore severe symptoms just because you are traveling. Repeated vomiting, inability to keep fluids down, severe belly pain, fainting, confusion, or signs of dehydration need urgent medical attention. Severe upper belly pain with vomiting can also raise concern for pancreatitis, which means an inflamed pancreas. Before departure, make 3 decisions in writing. Write down your injection day. Write down where the pen will stay during transit. Write down who you will contact if vomiting, severe pain, or missed doses happen. Make the plan visible in your phone and bag. Include medication name, dose, injection day, prescriber contact, allergies, insurance details, and where you could seek care. The best travel plan is not dramatic. Keep the pen usable, schedule clear, meals smaller, supplies reachable, documents visible, and warning signs taken seriously. The memorable rule is this: protect the medicine, but plan for the person carrying it. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.